All right, so this is real-time stuff, guys. We're in the exam room now. We're doing exam stuff. I try to keep it 2 to 3 minutes in the history room. I don't want to really spend that much time, just to give other time to adjust patients midway through. Once we get into the exam room, if I have another patient to adjust, I'll go adjust them. If there are no other patients, we'll go straight to the exam. I usually say boca abajo, por favor, and then I'll take them through, what's that? Hip. Wow, I'm blanking. The hip, where you bend the hip like that to put pressure on the hip joint, or you can do bilateral iliac compression just to see if there's a hip out of alignment. I'll press along the spine. I'll actually touch the spine. You can touch the skin too. People love that. Make sure that you look at the low back, the mid back, the neck. Just check everything, especially the area of complaint. So I'll walk them through some iliac compression stuff. I might push on the sacrum a little bit. I might palpate muscles along the spine too as well. Then after that, we go boca arriba. I'll do a straight leg raise. You can even tell them like, voy a levantar la pierna. And then I'll ask them, ¿te duele? Does that hurt? Or I might say, ¿te molesta? Does that molest you, right? Or does that bother you? Molest kind of is it's a weird word to think about, but it's actually molesta in Spanish, but it doesn't mean to molest. It means that it bothers you. Whereas in English, molest is weird. It's not the same, if you know what I mean. So in Spanish, duele o molesta, right? Does it hurt or does it bother you? Is what I'll ask. And so I'll lift each leg, do the sciatica. I might do like Faber's test too. So I'll bend the leg, put pressure on the hips on each front side, Faber. And then after that, I might do a Milgram's test too. If I feel like it's a low back issue, it could be like a disc related. So I'll do Milgram's. I'll say, por favor, levante tus piernas 2 segundos, okay? Mantienes aquí, 2 segundos, no te muevas. And then I'll leave them there. They'll just keep their legs in the air for 2 seconds. After that, relájate. After that, we'll go sentada, por favor. Sentada means seated. We have them sit right here. I'll walk them through range of motion. Easiest way for range of motion is just to say repite, por favor. Boca abajo, boca arriba. Duele o molesta? Does that hurt or bother you? And then they'll say yes or no. Rotation, rotación. And I'll say repite, por favor, así. Así means like this. It's a word. It's a really, really slick word to use, and it's only 3 letters. A-S-I, así, and it means like this. So, duele así, repite así, por favor. And then if there's pain, no pain, they'll tell you. And then if there's other areas that you need to evaluate, like a shoulder or an elbow or a wrist, you might ask them to do this, for example, for wrists, if it's a wrist pain. Have them stand up, do the lumbar range of motion. So it'd be así. Agachando, por favor. Atrás, lado a lado, rotación. And there you have it. That's the exam. Now, here's the thing. When you're doing the exam, probably the most important part is actually telling them what you're feeling. So if you're feeling like there's pain on that left side on the hip, and they're saying, oh, me duele. Yeah, es evidente que hay un problema con la cadera aquí. I'm telling them there's a problem here. Hay una problema, right? Hay un problema. Say it like that. Hay un problema. Or yo siento dolor aquí. Or yo siento una problema aquí. I feel a problem here. I feel pain here. I feel that there's something going on here, right? And then you can even follow up with something like, and we need to fix that, don't we? Necesitamos arreglar este, ¿no? Great, just phrases just to kind of start to understand what the patient's going through and let them know, hey, I'm finding out what's going on. You can say, duele molesta. Obviously, that's a great question to ask, but I think it's even better to state to the patient like what's wrong with them so that they know exactly why we're even taking the x-rays in the first place. Yeah, oh yeah, we want to check those hips. We want to check your neck because you can't bend it, right? Hay limitaciones con tu movilidad. Eso es la razón que necesitamos tomar las radiografías. right? There's problems with your range of motion. There's problems with pain. Your joints don't move properly. Could be a potential problem with your discs too, right? Disc space, I kind of talk about that. Los discos, posible que tienes un disco dañado. It's possible that you have a damaged disc. We need to go check that out. So then after the exam, takes about a minute, we head straight to the x-rays. So piece of cake, guys.